Good afternoon and welcome. I'm Elizabeth Hardig with the American Planning Association, and we're excited to have you all here for our Plan4Health Research Forum webinar this afternoon. I see a few folks are just entering the webinar room now, and I'll just take a moment to cover some housekeeping items. This webinar will be recorded, and we will post the recording and the slides on the Plan4Health website, right there in the chat box. We have saved some time at the end of the presentations for Q&A, but you're welcome to chat some questions as we move throughout the slides. And of course, take a moment to complete our poll if you haven't already. For those of you who are new to Plan4Health, it is a project supported by the CDC. The American Planning Association is the lead on the initiative and is partnering with the American Public Health Association to support community-based work across the country. We have two cohorts of 35 coalitions working to increase access to physical activity opportunities and to increase access to nutrition. This research forum series is part of the overall Plan4Health project to spread information and share resources at the intersection of planning and public health. So we are excited to have you all here today to talk a little bit more about health impact assessments. We have two wonderful speakers, and we're going to kick things off with Michelle Madeley from APA's research department. So Michelle is a research associate with APA's Planning and Community Health Center. Prior to joining APA, Michelle worked with Community Food Lab as a food systems designer in Raleigh, North Carolina. Michelle earned dual master's degrees from the University of North Carolina, Chapel Hill in public health and city and regional planning. As a graduate student, Michelle worked on several multidisciplinary research projects involving renewable energy, transportation disadvantaged populations, and parks and public health. Michelle previously worked in the political department of the League of Conservation Voters, an environmental advocacy organization in Washington, D.C. for 3 years, and spent time working on a small, diversified vegetable farm in Washington and Texas. Michelle also has an undergraduate degree in public policy from Duke University. So we are excited to have you here today, Michelle, and I will hand things over to you.
Thanks, Elizabeth. I'm going to kick things off by broadcasting the results of the poll. So thanks to everyone. I think most of you were able to participate and answer the question if you've been involved with conducting a health impact assessment. Can everyone see the results? I guess if someone could just type in yes or no in the chat box, that would be helpful. But the results are that 9 of you, so 30% of the folks on the call have, and 70% of you, or 21 people, have not participated in conducting a health impact assessment. So that's just helpful for us to know as we go through this presentation. It looks like a good mix, and hopefully this can serve as a great resource for those of you who have not been a part of conducting a health impact assessment previously. So I'm just going to hide the poll because it's covering up the slides, and go ahead and get started. So I'm going to talk about, I'll be describing APA's research project on health impact assessment in planning. So I'll share some findings from our summary report as well as some takeaways from our analysis. I'll also share a couple of quick snapshots from our case studies and close with a little bit of a question about what's next on the horizon. And the purpose of this research forum is not to go into great detail about what HIA is and what the steps are for conducting it, sort of the how-to, but I did want to provide this image to just so that we're all on the same page for the rest of the research forum. These are the 6 steps that are conducted in all health impact assessments, regardless of whether it's a rapid HIA or a really comprehensive HIA. So the first step is screening, which is the initial step to determine whether an HIA is needed and could be useful. Step 2 is scoping. In consultation with stakeholders, this is developing the plan for the HIA and identifying the potential health risks that might be explored. Step 3, the assessment, which is describing the baseline health of affected communities and assessing the potential impacts of the plan, policy, or project. Step 4 is recommendations, which are the practical solutions that could be implemented with regards to the project, policy, or plan. And reporting refers to the dissemination of findings to decision makers, affected communities, and all stakeholders. And the final step is monitoring and evaluation, which refers to monitoring the changes in the health of the community, as well as evaluating the efficacy of measures that might have been influenced as a result of the HIA. This also could refer to the process evaluation of the HIA process itself. And just to reiterate that public involvement and community engagement is really prioritized at all 6 of these steps in HIA. And for APA's research project, which has been supported by the Health Impact Project, a project of the Pew Charitable Trust and the Robert Wood Johnson Foundation, we're really interested in HIA's role in the field of planning. And so it was important for us to clarify definitions. So I just want to share those with y'all before we move forward. We're interested in the kinds of HIAs that planners specifically might be engaged with. When we refer to planning, we're talking about the plans, policies, and projects that govern how the built environment impacts an entire population in a specific geographic area. So these are the 3 sort of types of planning projects or planning HIAs that might address either plans, which are official documents that set goals, identify objectives, and establish policies that guide future development in a specific geographic area. So as an outgrowth of that, a policy is defined as an operational process or rule necessary for achieving the goals and objectives set forth in a plan. And finally, a project would be an action undertaken to implement a plan or policy. So just as a couple of examples, I'm sure you can think of a 1,000 types of plans, from comprehensive plans to a corridor plan or a functional plan, like for a park system. A policy might be development regulations and zoning codes, and projects might be, building a new community facility or a mixed-use development. And in our research, we surveyed the field of planning HIAs conducted or completed between 2004 and 2014, just to set kind of a nice round 10-year period. And as you can see, in 2004, there was 1 HIA completed. And flash forward to 2014, there were 23 HIAs completed. And as you can see, there was a peak in 2012 with 29 HIAs completed. So it's kind of unclear, what the following 2 years, if that represents a decline, but it is interesting that there was sort of that peak in 2012, and our research didn't really go into details to explain a lot of that peak in 2012, but I think that's interesting. Some of our other findings about the planning HIAs reviewed, there were 134 in that 10-year period, and a clear majority, as you can see, fully 2/3 of planning HIAs were focused on plans, and that's and then the other third were kind of split between policies and project actions, with only 11% on specific projects. And then if you look to the next table, which I think the font didn't translate completely, so the numbers are a little wonky, but we categorized all the different topics addressed by HIAs. And so we categorized that into 14 different categories, which I think reflects sort of the comprehensive nature of planning as a field, and how many different ways planning intersects with human health and health behaviors and health risk factors. So over half of the planning HIAs were in reference to land use topics, but then they were as wide-ranging from transportation, public finance, disaster mitigation, community services, climate change, infrastructure. So there's kind of a wide variety, and I think that is something that's really unique about the field of planning. And this is a map to just planners love maps, I think, so we wanted to show where the planning HIAs we reviewed were actually conducted. And it's kind of hard to read the legends, but hopefully this gives you an overview of where those HIAs were conducted. And then the green, so all of those points were the 134. The green box is represents one of the 27 that we reviewed for a more in-depth analysis, and then the red dots are the 5 that we selected for case studies. And some of the findings from our research really kind of told us a lot about the methods that planners are using, and that involves HIAs employing a lot of different data sources. HIAs employ publicly available data as well as more specialized local data. And some of the major sources of data for HIAs are peer-reviewed journal articles, government reports, non-governmental organization research and publications, data clearinghouses, and then some actually, involves new data collection. So using surveys, focus groups, and doing data collection for the HIA itself. HIAs also use a lot of indicators to guide the framework. And so some of those are readily available metrics that you might just get from one of these data sources, and others were derived and sort of using indices. And so looking at across the board, there was a mixture of population health and planning indicators. Some of those population indicators would have to do with demographics like race and ethnicity of a population, economic indicators of income, unemployment, or an example of a derived indicator here might be the proportion of jobs paying a livable wage. So that would involve kind of some extra number crunching to get to that data that comes from publicly available sources. Some health indicators would include health behaviors like physical activity and health status, like obesity rate. And planning indicators could be environmental, something like total impervious surface area in a community. They might have to do with transportation, like transportation mode split, average vehicle miles traveled, access to parks, or other proximity to goods and services. So there's a mixture, and that's what's really great about HIA bridging the fields of planning and public health. In terms of recommendations coming out of these HIAs, they frequently, what I think is interesting is how they engage a variety of stakeholders. So they frequently included suggestions for planning and public health departments, as well as other organizations and community partners. So I think that reflects the sort of multi-pronged, multi-sectoral solutions for health improvements. And the recommendation strategies actually were pretty reflective of the topics addressed through the HIA. So if it was a land use HIA, a lot of the recommendations would involve changes to zoning or other land use topics. And just to show a quick snapshot of 2 different case studies that we reviewed. One HIA was conducted in Kane County, Illinois, and it's called the Growing for Kane HIA, completed in 2013. And this was a county-level decision addressing a policy. So one of the roughly 22% of HIAs planning HIAs that reviewed policies. And this was an HIA conducted on a proposed amendment to the county's farmland protection program, which had been in place for over a decade at the time. The HIA ended up recommending creating a separate sister ordinance to the farmland protection program, rather than tacking on this amendment that was designed to increase participation from smaller farmers in this agricultural conservation program. And the sister ordinance was designed to actually do more and allow the farmland protection program to remain intact and continue doing what it had been doing very well. And this was some important cross-sector work, and it has actually continued through the application of actually many of the recommendations from the HIA. For one example, one of the other HIA recommendations, in addition to creating this separate ordinance that was adopted, was doing a feasibility study for a food hub in the county. And part of that work of doing the feasibility study has been supported by Plan4Health. So we're really great to see that intersection of some of APA's work and involvement from HIA to sort of an implementation of an HIA recommendation. And then another case study, just to give another snapshot of a different type of HIA. In Atlanta in 2012, there was an HIA conducted of Plan 2040, which is the region's plan that connects land use and transportation plans. If you think of Atlanta being quite a big metropolitan area, there are multiple jurisdictions involved, multiple scales of government involved in a regional plan. So there's not usually a mechanism or entity responsible for ensuring consistency between land use and transportation plans, but this HIA kind of provided an opportunity to, a mechanism to ensure that that was done. So this was one of the roughly 2/3 of the planning HIAs done on a plan, but regional plans were actually less common than some of the land use and comprehensive plans that made up the bulk of that 2/3 of the planning HIAs. Another takeaway from this case study is that this HIA led to over 200 recommendations. So if you think about sort of the scale of that, that can be pretty cumbersome to go through. So a follow-up project was conducted to prioritize those recommendations and actually to restructure, and led to restructuring within the Atlanta Regional Commission which has resulted in better incorporating health into their structure. And some big picture takeaways from this research are that HIA and planning share best practices and core values. So data-informed decision-making, community engagement, community building, especially among vulnerable populations, flexibility, and a dedication to process as well as outcomes are foundational to both HIA and to the field of planning. So really they reinforce each other, prioritizing both quantitative data and engaging with communities to get input that way. And HIA also illustrates a number of connections between health and planning. So it's a tool to apply health data to planning, but it also illustrates the links between health and current and future conditions in our communities. It can also illustrate some non-traditional links. If you think about sort of the direct connections between health and planning, there are also the more indirect ones that can be uncovered through planning HIAs, such as the economic impact and how that relates to health and to planning. HIA catalyzes and fosters cross-sector collaboration. It's a great tool for initiating collaboration among diverse sets of stakeholders that may not have opportunities to work together, or for strengthening emerging collaborations. It can help build capacity for future partnerships, leading to more synergistic efforts on planning and public health over time. And finally, HIA is evolving. It's evolving towards a more integrated process because it's providing a framework to include health considerations from the very beginning of the planning process. So hopefully over time, this can actually really advance and promote a health in all policies approach. HIAs are also beginning to address more complex issues, such as complex financial investing platforms, other emerging issues like criminal justice. There's a lot of new directions for HIA. So looking ahead, this research that we gave you a little glimpse of today will be released as part of a summary report that we'll be releasing soon, along with an issue brief for policymakers and a toolkit for planners that we're really excited to be developing. So that will be more of the how-to, specifically with regards to how it can fit into the planning process. Big picture, there are a lot of ideas, a lot of takeaways that I'm sure you all are experiencing in your communities. If you haven't done an HIA, there might be some challenges to bringing HIA to your community, and that could involve finding funding sources. So that's another thing that we're thinking about. And as researchers, of course, as we're concluding some of this research, we're actually our conclusions are often new research questions. So thinking about evaluating HIA recommendation implementation, post-HIA outcomes, those are all things that I know that are buzzing in my mind. And really, again, just to reiterate, leveraging the HIA process to promote health in all policies approaches, just to underscore that the final outcome is not actually the HIA, but finding ways to promote health through planning. And so with that, I'll just wrap that up. And if anyone has questions, feel free to chat them. And I know Sarah's going to provide a lot more great information. Thanks.
Thank you, Michelle. That was a fabulous summary and a great way to orient everyone to HIAs in general and your recent findings through APA's research. So thank you for that. And of course, it's always fabulous to see a Plan4Health community highlighted and really to see how Plan4Health is fitting in with other activities happening at APA and across the country. So our next speaker will take a deeper dive into HIA work and her recent research. Sarah Hammerschmidt, a Director of Content at the Urban Land Institute, where she develops content and programs focused on the impact of the built environment on public health through the Building Healthy Places initiative. Through her career, Sarah has done extensive work on issues that lie at the intersection of health and the built environment. Previously, she worked at PolicyLink in Oakland, California, researching the inclusion of social and economic equity into projects, plans, and policies that are being implemented at the intersection of the health and the built environment. Sarah has spoken on the topics of health impact assessments, the role of urban planning in creating healthier cities, and recommendations for incorporating health into all built environment decision-making at several national conferences. Sarah holds an MS and a PhD in Community and Regional Planning from the University of Texas at Austin, where her research focused on developing recommendations for how planning departments across the country can incorporate public health considerations into their work. Sarah also holds a BS in Industrial Operations and Engineering from the University of Michigan and worked for 8 years in the technology industry prior to grad school. So we're so grateful to have you with us here today, Sarah, and I will hand things over to you.
Great. Thank you, Elizabeth. So good afternoon, everyone. As Elizabeth said, my name is Sarah Hammerschmidt. I'm a director at the Urban Land Institute in Washington, D.C., where I work on our Building Healthy Places initiative. And if you're not familiar with ULI, we are a membership and education organization with nearly 40,000 members globally. Our membership is comprised of professionals who work in the real estate development and land use arenas, including developers, designers, investors, as well as public sector employees. And our mission is to provide leadership in the responsible use of land and in creating and sustaining thriving communities worldwide. And since we now know that health is such an integral part of these thriving communities, ULI launched the Building Healthy Places initiative in July 2013, so just about 3 years ago, to engage our membership and our larger networks in shaping places and projects in ways that promote health. And the BHP initiative was launched out of a recognition that many global health trends are pointing in the wrong direction. For example, the U.S. is spending 17% of our GDP on healthcare, up from just 7% in the 1970s. So health concerns related to physical activity or physical inactivity, diabetes, asthma, and heart disease are on the rise, and ULI recognizes that the real estate community needs to do more to be part of the solution to these global health problems. So the initiative has produced a number of publications and health-focused events over the past several years, which you can learn more about at uli.org/health. And additionally, as Elizabeth mentioned, I recently finished my doctoral work at the University of Texas in Community and Regional Planning. My research focused on how planning departments across the country are considering health within their work, partnering with health departments, and using health impact assessment. So I'll be sharing some of the results and the takeaways from that research today, as well as some work that I have done looking at how the real estate development community has been involved in HIA and incorporating health into their projects more generally. But before I dive into the research and some case studies, I just want to share a few more basics about health impact assessment. So HIA is an evidence-based process that really engages the community, gathers health-related information, and identifies strategies to improve community and individual health. HIA is used to identify potential health impacts of projects, plans, and policies, and consists of 6 stages typical to those used in other types of impact assessment, as Michelle mentioned: screening, scoping, assessment, recommendations, reporting, and monitoring and evaluation. HIAs can be applied to a variety of topic areas, as Michelle mentioned, ranging from natural resources to agriculture to the built environment. And using a broad definition of health that focuses on health as more than just the absence of disease, an HIA can show how a project or a plan or a policy may affect a wide range of health indicators, such as noise and air pollution, access to jobs, housing, food and services, and opportunities for physical activity. An analysis of and recommendations from HIAs can ensure that planning and development projects maximize community benefits and minimize adverse impacts on health. HIAs are more flexible generally than other types of impact assessment that planners are more familiar with, such as environmental impact assessment. They can take a variety of forms and a variety of lengths of time to complete depending on what level of analysis is needed. So, for example, a desktop HIA provides a pretty broad overview of health impacts and may only take a few weeks to complete, although they typically exclude direct input from community members. A rapid HIA is also conducted relatively quickly while still having some level of community participation and input. And then a comprehensive HIA includes a very robust community engagement process and gives an in-depth assessment of health impacts, potentially taking many months to a year or more to complete. And findings from HIA, and primarily those that include the last stage, the evaluation and monitoring of outcomes after a project is completed, can be used to inform similar HIAs and really help add to the evidence base to advance the understanding of what strategies work to improve health. And this is just something I found interesting. It's kind of a slide you can't really read, but the first documented HIA dates back to the early 1990s, so not really that long ago, in Manchester, England. So it was in response to public concerns over an airport runway expansion. The Stockport Public Health Department analyzed health impacts as part of the planning process, and the analysis found that while there were some positive community health impacts for things such as job creation, there were negative impacts from the increased traffic that would be generated. And based on the findings, the developer actually made adjustments to their plans to mitigate noise and to provide additional public transit service. Some countries, including Canada, Australia, and New Zealand, have actually integrated rigorous human health considerations into their mandated environmental impact assessments. But in the United States, an EIA is mandated only for certain projects with likely environmental impacts, as HIA remains a separate and a voluntary method. So the most effective HIAs are conducted early in the decision-making process, allowing for the implementation of HIA recommendations before a project is finalized or approved. And the cost of conducting an HIA can vary pretty dramatically, ranging from about $10,000 for a smaller HIA to $200,000 for a comprehensive HIA. And they're typically funded by grants from government agencies and health-focused foundations, including the health impact projects that Michelle mentioned. As Michelle also discussed, HIAs are growing in popularity, although we may have seen them waning over the past couple of years. According to the Health Impact Project database, fewer than 20 per year were conducted between 1999 and 2009, and then again in 2012 at our peak, more than 50 were completed. But last I checked about a year ago, there were 80 HIAs in progress. And they typically involve stakeholders from different disciplines, and they engage groups who don't usually work together. So with some of those basics outlined, I'm going to next discuss part of my dissertation research, which I started with a nationwide survey of planning directors in medium to large-sized cities in the fall of 2013. And one of the objectives that I set out to discover with this research was to really understand how health impact assessment was being used within planning departments across the country. So I sent out 433 surveys, ended up with 145 responses, a rate of about 33%. Wish it would have been higher, but I was okay with that number. And among the many questions that I posed to this group regarding things such as perceptions of health in their city, prioritization of health concerns among leadership, and collaboration with health partners, was about the use of the health impact assessment tool. And what I found from the group of respondents was that a very small number of planning departments had been involved in an HIA, just over 14% or 21 respondents. The majority indicated that either an HIA had not been conducted by any city department, or they did not know if one had been conducted in their city. So for the 14% of respondents who indicated that their planning department had been involved in an HIA, I asked some follow-up questions. And their responses indicated that HIA has become more utilized in recent years. 13 of the 21 said that HIA was first used in their city in 2009 or later. With the engagement of planners, HIA has been used primarily on assessing city, regional, or area plans, similar to what Michelle found. And HIA has been largely initiated on a voluntary basis rather than mandated by some sort of local existing regulation or process. So once the survey was completed, I conducted follow-up interviews with planning and health professionals in 5 cities: San Francisco, Columbus, Ohio, Seattle, Cincinnati, and Orlando. And the objective of these interviews was to get more information on how the departments have collaborated in these cities, as well as the role that HIA has played. So there's been a lot of literature out of both the health and planning fields that's really promoted HIA as a process that should be widely used in order to integrate health into planning processes. But when I conducted these interviews, the majority of interviewees indicated that HIA may not be the best enduring method to facilitate collaboration between planning and health departments. So interviewees in cities that had had experience with HIA, which were San Francisco, Columbus, and Seattle, noted that the tool is a good catalyst to get planning departments and other agencies thinking about the health implications of the projects and really make the initial connections between the planning and the health departments. However, these cities have started to evolve to incorporate health department staff and health considerations at the beginning of their planning processes rather than pursuing a parallel HIA process. And interviewees generally agree that there are other, perhaps better, ways to bring a health lens into the practice of planning. So if not HIA, what's a good way to get health outcomes more included within land use processes? And I found there's really, unfortunately, no one magic tool or process, but instead, collaboration between departments is really key. Health partners are typically an underutilized resource for planners, and many health partners that I interviewed were eager to be invited to participate in plan and project review processes. And interviewees also talked about the benefits of informal knowledge sharing and education sessions between health and planning departments. These can occur in such spaces such as brown bag sessions, informal lunches, and coffee meetings. The state of Florida Health Department has a Take Your Planner to Lunch program that has resulted in many successful collaborations between health and planning departments across the state. And planners could institute a similar Take Your Health Partner to Lunch program. Some cities have developed their own tools and processes as well that have the potential to be adapted and shared more widely among planning and health networks. For example, the Seattle Planning Department developed the Healthy Living Assessment that brings health data and health goals into the neighborhood planning process. And this is actually based on the Sustainable Communities Index that was developed by the San Francisco Health Department. And lastly, many cities are looking at adopting a health in all policies approach, where the complex factors that influence health and equity are addressed across all departments and sectors, including planning. The goal of this approach is to ensure that decision makers are well informed about the potential health consequences during the decision-making processes, and this would require health partners to be engaged in collaborative work with many other departments. So switching gears, I'm going to transition from a focus on planners in HIA to a focus on developers in HIA. And I think everyone on this webinar would hopefully agree that considering health within land use decisions absolutely needs planners on board to ensure that decision makers and planning processes themselves are well equipped to consider health, whether through the use of the HIA process or through other mechanisms that facilitate collaboration between health and planning. But there are many other partners and stakeholders who can contribute to healthier cities and neighborhoods and places. Developers have a pretty big role to play, and especially since planners and developers rely on one another to ensure that good projects are approved and built, there are opportunities for developers to be more involved in creating healthy places. Developers can create projects that have increased access to physical activity opportunities and healthy food, that have spaces and programming that encourage social interactions, and that have healthy indoor and outdoor environments. So we've been encouraging our ULI members and the development community overall to form partnerships that support health goals, consider health at every stage of real estate development, measure health outcomes, and try to gain a deeper understanding of community health needs. And this is going to require them to partner not only with health partners, but with planners. So in cases where an HIA is determined to be appropriate, the pump is really being primed for developers to be more engaged in the process. And there are some examples of HIAs where developers have been engaged in the process and ultimately projects have been changed in positive ways due to the HIA findings. So I'm just going to give a few examples here. A 2006 rapid HIA in Oakland, California produced findings that resulted in changes to a proposed retail and low-income senior housing project. It was one of the first HIAs conducted in Oakland, and it served to raise awareness of health among area residents, community-based organizations, developers, and local officials. The proposed project is located in West Oakland, which has disproportionately high rates of chronic disease due to poor air quality and noise from diesel trucks that move to and from the Port of Oakland and from nearby freeways. So because of the proximity of the site to a freeway and to the port, air pollution and pedestrian safety were major community concerns. The organization that conducted the HIA, Human Impact Partners, engaged the developer, the East Bay Asian Local Development Corporation, in the HIA process. And although ultimately the developer could not address all recommendations from the HIA, specific modifications to the project included an upgraded ventilation system, balconies that faced the freeway were turned into bay windows, and I think most strikingly, the main entrance, which was originally located facing the freeway, was reoriented away from the freeway and through a noise buffering courtyard. So in 2009, the Denver Housing Authority was looking to improve the quality of life of the residents of Mariposa, which is formerly known as the South Lincoln Homes. An architecture and design firm, Methuen, suggested using HIA and a health approach. So for the redesigned housing development, a rapid HIA was used as part of the existing conditions analysis. The developer, the Denver Housing Authority, provided baseline data for the HIA, and the output showed serious health issues for the existing residents. So that, for the developer, it really hit home the role that they could play in improving and influencing these health outcomes. So the rapid HIA inspired the Denver Housing Authority to create a toolkit for ongoing development of the project called the Mariposa Healthy Living Tool. Phase 1 of the project was completed in 2012 and includes many health-focused elements and programs for the residents, such as job training, social activities, health programs, and community gardens. And then another recent HIA that involved developers was in New Orleans, and HIA is the Claiborne Corridor. This HIA has engaged the developer, Alembic Community Development, who is renovating a 100-year-old school building into a new food market, retail, and co-working space. And the developer saw being involved in the HIA as an opportunity to continue to build community support around the project, which had a goal of improving health outcomes through access to healthy food and incentives to promote healthy choices. The collaboration on the HIA with the local health department allowed the developer to receive more community feedback around the project, and through the HIA process, they worked to incorporate those community needs into the project. So one concern for developers regarding HIA is that they can be very time-consuming and impede the development process. And developers have a lot of things to consider within their projects, including financing and permitting. And while the health outcomes impacted by development projects are critical, it's really important to frame this to the development community in a way that helps them see the value of including a focus on health. So this could include the opportunity to showcase the health benefits of a project to a broader audience, which could potentially increase the market value of the project. Developers being included in an HIA up front may mitigate any delays that might occur for the development project based on the findings of the HIA. Developers don't like delays. Developers can proactively address these issues that could potentially result in the delays of project approval or permitting. Developers can also help validate the feasibility of HIA findings, especially from a financial perspective. Primarily for HIAs involving development projects, there needs to be a thoughtful balance between improving the sustainability and the health impacts of a project and the financial success. And additionally, developers can be engaged with collecting baseline community data as well as new data upon project completion to help track health outcomes, which is something that we often promote but often find incredibly difficult to execute. This is helpful to built environment and health fields in general to understand what works and what doesn't to improve health outcomes. So overall, based on both my dissertation research as well as the research and case studies on the role of developers in health impact assessment, most people I talked with indicated HIA may not be the best tool to use to ensure that all projects and plans and policies consider health, though ensuring health is included is certainly a goal that is of interest. So although HIA may not be the silver bullet, many interviewees from my dissertation research described HIA as a great tool to use as a catalyst to get the planning and health departments collaborating, especially if neither department has been engaged in work related to planning and health. Additionally, it's a useful tool to use for plans, projects, or policies where there are truly unknown health impacts or on high-profile projects. So bottom line, if you're interested in performing an HIA, make sure that it's truly necessary based on the specific project or plan or policy in question. And if it's a project-scale HIA, reach out to the developer, explain what you're trying to achieve, especially if the HIA is marketed as a way to gather data about the project and make recommendations to improve the health of tenants and therefore the marketability of the project. Developers are more likely to be receptive and interested in collaborating. So with that, thank you for joining this webinar. My contact information is listed, so if you have any questions post-webinar, feel free to reach out, but I'm happy to answer any questions you may have about HIA, about health and planning more broadly, or about the work happening at ULI on our Building Healthy Places initiative, and I'll turn it back to Elizabeth.
Great, thank you, Sarah. That was very interesting and informative. I have to say, we have found very similar things in Plan4Health as well, the kind of thinking about HIAs or even the Plan4Health project as a catalyst, but really it's about this broader relationship building, and I love the idea of a take your planner to lunch day. I think that's a fabulous way to get the conversation started. So while folks are chatting in their questions here, we did have one more slide just about general resources that might be of interest to our listeners today, and maybe that's a good place to start with some of our questions. If folks are thinking about an HIA or would like to get started, what types of what types of resources exist, and how would you recommend that folks take the first step?
I think the resources that you have listed here are great. I was going to mention several of them. Let me see. Yeah, so you have Human Impact Partners training. Additionally, there's a 4-day training in Oakland, California that I believe they do every year that's hosted by HIA practitioners from the San Francisco Department of Health and their partners. Another good resource is the databases of completed HIA reports. A number have been done. A lot of them are public, and they're really good places to start just to see the structure of an HIA and to make contacts with people that have completed them that can help sort of guide you through the process. So the Health Impact Project and Human Impact Partners, very confusing that they have very similar names. They both have databases of completed projects. There's also, I don't believe this is updated anymore, but there's a UCLA Health Impact Assessment Clearinghouse. The website's hiaguide.org that has also compiled a number of health impact assessments. And then organizations like NACCHO, like Human Impact Partners, and the Health Impact Project, and SOPHIA, which is the Society of Practitioners of Health Impact Assessment, all conduct and advise on HIA. So they have great resources on their websites for how you could get started in the practice.
And this is Michelle, and I'll just also put in a plug for APA's a toolkit that is going to be coming out later this summer or early fall that's really going to be geared specifically to planners who might be interested in HIAs. So it'll have guidance on, who to reach out to, what are some of the other stakeholders you might be considering, data sources, and then, adapting for local context. So it's not to replace or to be redundant of existing resources, which are quite comprehensive and really on point, but it's just a tailored toolkit that we'll be releasing soon.
That's great. That's very.
And that's going to. I'll just add. I think that's going to be a really great tool because it's actually focusing on the role of the planner. A lot of these other resources are more general about HIA practice and likely more targeted at the health sector, but this toolkit's going to really be incredibly helpful for planners that want to figure out what their role is within these processes.
That's great. That's a great point. And I think your initial thought too, Sarah, about just reviewing the database of completed projects is also a great place to start to kind of get a sense of what the outcome will look like and how you could take the first step. Some folks have chatted some additional resources into the chat box, so Sophia that Sarah mentioned, and also referencing the CDC, which is a fabulous resource, their Healthy Community Design Initiative. The first link on the top of this slide is really takes you to the Plan4Health website, and there's a long list of previous webinars and other resources that might be helpful as well. So it looks like we do have a question from John. Has anyone had any experience with the rapid HIA training that is available from the Walkable and Livable Communities Institute? And I'll turn that over to you, Sarah and Michelle, but if other folks on the line have experience, feel free to chat in and share, or you may unmute your line by hitting #6 and just joining the conversation.
I don't know about you, Michelle, but I haven't personally. That's good to know that training is out there, though.
Yeah, I also haven't done that personally, but it's, yeah, great to know of another resource. We'll certainly add it to our list.
Yeah, and I think it's nice that HIA is so flexible and that we have a rapid option. I think is always great, especially when you're at the beginning of a big project and you're trying to bring in perhaps developers or other folks who might be a little bit intimidated by the process. I feel like just having that word rapid there makes everyone a little bit more relaxed. So certainly, John, if you end up taking the training, keep up in the loop, and if other folks who are on the line have experiences that they'd like to share but perhaps don't want to share right now over the line, you're welcome to send me a quick email, and I will pass that along to John, and I'll just chat my email address right now. So I know we've spent a lot of time talking about the benefits of HIA and thinking about HIA as a process or a catalyst to move forward the cross-sector collaboration between public health professionals and planners and developers, and also to really think about this health in all policies approach. But maybe we could turn the question around a little bit and think about some of the challenges. So we could maybe start with you, Sarah. Would you say what are some of the main challenges, or maybe what should we kind of warn folks about if they're starting out in their own projects?
So I think one of the challenges is just there's a general lack of training and experience with HIA. So people may know generally, like, okay, I know I've heard of health impact assessment, but there still aren't a lot of people that have actually, in the grand scheme of the planning world and even the public health world, there aren't a ton of people that have actually conducted an HIA or been involved in conducting an HIA. So I think that general lack of training is a big challenge. And I think, it's great that there are probably more HIA training opportunities than, Michelle and I have even learned about to really give people a good introduction into the practice of health impact assessment. And I think another challenge is still, our fields are still very siloed. So just communication barriers between disciplines. I think often, the planning department will be working on a plan, and then the health department will catch wind of it when it's already almost done and decide they want to do an HIA, and they find all these things, but it's too late to incorporate them into the plan. So, regardless of whether or not an HIA is on the horizon to be conducted, working to break down those communication barriers between the fields, because, research has shown that the planners do have an impact on health in terms of chronic disease. The way that we plan and design our cities has a huge health impact in this country. So bringing in public health partners, bringing them to the table, the decision-making table, I think is really critical, in HIA practice and just more generally. I'd say another challenge is communicating with and convincing the decision makers. So, HIA can be helpful because it brings some data that shows, why health needs to be considered and what some potential impacts might be of not considering health. But I think it's always still a challenge of, making sure that the right people are seeing the results. And also, I'll just mention one last thing and then turn it to Michelle. Health impact assessment, as both of us discussed, can be done on so many topics, and topics that don't necessarily impact, or that planners don't necessarily address. So I think another challenge is just for planners to understand which HIAs that a health department might be conducting make sense for them to be involved in.
Yeah, I mean, and I will add to that, I think Sarah kind of ran through a lot of really important factors that can become challenges for HIA or for planners interested in HIA. Another just sort of low-hanging fruit challenge can be how resource intensive they can be. They require funding to complete and staff time, and so if there's not a dedicated source of funding, that can be a big challenge and barrier. And then in terms of, again, I think this kind of plugs into what Sarah was saying about the collaboration and just how the timing of the HIA can be really critical. And so thinking about when is the right time to do the HIA so that the HIA recommendations can be meaningful and can be applied and adopted, before the project has already been built or before the plan has been adopted and put into place. Thinking that far into the future can be difficult to time it right. And again, I'll just say that probably this connects with Sarah's comments about convincing decision makers to get on board. I think thinking about how health impact assessments are considering long-term health effects, and we won't have data on those long-term health impacts for a long time because they're long-term. So actually having the evidence of how significant an HIA might be, we don't have a lot of data about that, and so that's something that maybe could be difficult in that conversation, but there are so many other things that can be a part of the conversation with decision makers, but that unfortunately doesn't seem to be one that we have a lot of information on right now.
That's a great point. Generational change it's hard to make the instant case for that when we're really thinking in terms of the long view, especially with chronic disease prevention. And I'm so glad you raised the point about dedicated resources. I have to say I was a little bit shocked at the range there that you shared, Sarah, that HIAs could be cost as little as a few $1,000s up to $200,000, I think was the high end there. And of course, again, there's some flexibility and every community is different, but being able to set aside both financial resources and time of staff and community members is certainly important.
And I think, to follow on to that, that sixth step, the monitoring and evaluation, and that's the more long-term measuring that happens after the HIA is actually completed and things have been implemented, a plan has been adopted, et cetera. I think because of funding and resources, that phase is often not actually completed.
Interesting. And while folks are chatting in their questions, I did want to circle back to the topic of communication and jargon, and that's certainly been a theme with the Plan4Health project. Of course, our goal is to reunite planning and public health, reconnect these two sectors, and so we have had a lot of conversations with coalitions across the country about jargon and really being able to communicate across these silos. And then, of course, communicating to decision makers and thinking about other stakeholders that you'd like to have at the table and how do you make the information accessible and relevant to them. And is it an infographic? Is it a tweet? Is it a website? And so we've spent a lot of time in Plan4Health thinking about this communication angle, both as part of the work of completing the project, in this case the HIA or other community-based strategies, but then also this dissemination piece. So how do we impact beyond the funding period or future decisions? And so I'm glad you raised that here. I think that continues to be a challenge and one that we will all work on. I just listened to a webinar the other day about not using the term built environment and how folks, community members don't find that term very accessible. And of course, that is one of our go-to terms. So I have to rethink that.
That's interesting because it's jargon not just from a disciplinary perspective, planners have jargon and public health has jargon and developers have their own jargon, but what resonates with the community. My dad actually he asked me not too long ago, what does this placemaking term mean? I don't like this term. He's a plant pathologist, so he's not in this field at all. And I was like, okay, I'm not sure what, but I mean, yeah, if these aren't terms that are resonating with the general public, maybe we all need to sort of collaborate to figure out what might be a better dictionary for, all of us, all fields that are involved in health and land use and whatever term we come up with for built environment.
Mm-hmm. Yeah, and one thing that I think is great about health impact assessment, and certainly kind of shines through in some of the case studies, is that actually going through the steps of the HIA provided opportunities for, to engage with the community at all steps and to hear from the community and to get their input and to also kind of share about what the projects and plans are. So in some ways it does become another platform for communicating with that really important stakeholder group, the community and residents. So yeah, that's a great point about just the range of stakeholders that you would be communicating with through an HIA, and kind of using that as a way to leverage that opportunity and really trying to be clear in using terms that everyone can get involved, everyone can understand, from your typical resident to a decision maker to Sarah's dad.
And I think another point, it's taken us a really long time to evolve into these silos. So, I mean, it's going to take us a long time to hopefully not as long, but to really fully, feel like we can collaborate across disciplines. So, I don't expect it to happen tomorrow, but I think, I would encourage everybody on this call, go figure out who in your health department or who in your planning department you could start talking to. I think a lot of, planners just generally, I think like health departments might know who to contact in the planning department because it seems a little more clear, but health departments are enormous, and you don't always know who the right, section is of the health department. So, like an epidemiology group, or there are groups in some health departments that have a focus on land use. I would encourage everybody to just start the conversation, find out what they're working on, let them know what you're working on. I think there are always potential ways to collaborate.
That's a great point. That's a great point. And I think that's been another lesson learned with our Plan4Health coalitions. It's remarkable how many projects people are tackling at the same time within planning, within public health, and within the community at large. I know one of our projects in the first cohort of Plan4Health focused on one neighborhood in the city of Austin, Texas, and they found 40 or 50 nonprofits working on very similar initiatives and strategies, and so there are opportunities for collaboration both across our planning and public health sectors, but really other folks in the community who are like-minded and who want to create healthy, vibrant places as well. So it looks like we might have one question coming our way, one last question, and we have a couple minutes left in the webinar. While we're waiting for folks to submit that, any final thoughts from you, Sarah or Michelle, or any last-minute recommendations for folks?
I think, like I said, I just would encourage everybody to try to make these new connections. I think it's always hard, going outside your comfort zone and maybe talking to people that aren't as involved in what you perceive to be your day-to-day work. But, it's always, you never know who might be working on, like the story you just told, Elizabeth. You never know who might be working on things that are similar to things that you're working on and how you might be able to help each other and not be working on parallel efforts.
Mm-hmm. And it looks like we are just approaching the 4 o'clock hour, but we do have a last question here that I'll go ahead and read and hope you all can stay with us. So Tracy is asking, by the time developers submit plans to planning departments, the majority of planning is already complete. How would planners reach out to developers ahead of time to have them consider HIAs?
That's a good question, because I guess you might not know until they submit their plans. And, a lot of the work that we're doing at ULI, since we are, a membership organization for developers, is to encourage them to consider how their plans impact health and include some, amenities or things that we've found to improve health. We have a Building Healthy Places toolkit with 21 recommendations that we've been sharing widely within our network. For the examples that I mentioned, those were all specific projects that the developers had put into place. I think, one thing that I think planning departments could do, and this is not necessarily easy, but implementing some sort of development code that has some just at the very basic, have certain things that we know improve health be required of developers. They may not like it, but if it's a requirement from a city, then they would have to adhere to it, and then you'd get plans that are more aligned with the values of the city and improving health.
Mm-hmm. That's great, and I do think this also gets back to the point about relationship building. Of course, not in major cities, you can't be necessarily connected with all developers and vice versa, but I think in smaller places and certainly in some of our rural communities in Plan4Health, folks know each other and start to share ideas and plans earlier on, which is always great.
Oh, absolutely. And, developers typically develop more than one project. So even if on one specific project they may not, do the things that the planning department would recommend, then you can sort of set the stage for them for, with their next proposal to be more thoughtful about including health, or to reach out to the planning department earlier in their planning process, in the developer's planning process, to, make sure that the discussion has been started.
Mm-hmm. Great. And we do have a comment from Ruth. For developers seeking green building certifications, there are now criteria and credits that encourage the use of HIA-inspired approaches, which is fabulous. So that's exactly what Sarah was recommending, and that we can hopefully incorporate elsewhere. So we are just, and thank you, Ruth. So there is a link right there in the chat box. So we are a couple of minutes past the hour, and thank you so much for taking the time to join us this afternoon. I will stay in the webinar room. If you'd like to keep chatting back and forth, that's certainly fine. You're also welcome to unmute your lines and chat over the phone if you like, and I'll be here for a few more minutes. But the webinar will officially close. So thank you so much, Sarah and Michelle, for sharing your expertise. This has been a really fabulous conversation.
Thanks so much.
Thanks, everybody.